Hello, this is Dr. Shiroko Sokitch, owner of Heart to Heart Medical Center and the author of the book, Healing When It Seems Impossible, 7 Keys to Defy the Odds. And I'm so happy to be here today. I hope you enjoy this talk. We're going to be talking about headaches. And I'm going to use Chinese medicine to explain one, what kind of headaches there are, and two, how to use acupressure, so working on yourself to help you feel better. So this is super exciting because you'll get to give yourself some relief when you have a headache. So there are, in Chinese medicine, headaches are not just headaches. There are different types of headaches based on where in your head you have the sensation. So I'm going to talk to you about how the organs work a little bit and then explain what type of headache is on what position of your head. And then I'm going to give you some acupressure tips that you can use to feel better. Does that sound good? Cool. Okay, so first of all, in Chinese medicine, the organs work differently than they do in Western medicine, and they're connected to many other things. So when you have an imbalance in an organ, you may have a whole collection of different symptoms that may be related to the headache that you have. And then, so finding the right organ system that is out of balance is really key to how you're feeling. And I'm going to talk about the main organs that are involved in having headaches, which is really basically 3 systems that might be involved. So there's a frontal headache, so a headache that's right here in the front of your face or in your forehead right here. And that would be connected to your large intestine or your lungs. And in Chinese medicine, the lungs and large intestine rule your entire respiratory system, starting with your nose, your throat, your physical lungs, your large intestine, your skin, and your ability to protect yourself from things that come in from outside. So if you, let's say you got a flu or a cold or something like that, it wouldn't be surprising that you'd have a headache right here. And that type of headache, you might have heard a lot about that type of headache, because a lot of people say, oh, if you have a headache, just press this point right here. That's between your thumb and your forefinger, and you can kind of squeeze that point there. You can find a point. And if you have this type of headache, it's going to feel better if you just squeeze right here in the thumb, between the thumb and the forefinger. And so that type of headache could be connected to having a cold or having some congestion in your nose or a flu even, or something like that. Or it could be connected to some chronic problem with your intestines. So like, let's say you had chronic irritable bowel syndrome or something like that, and you kept getting these kind of headaches. So that would be connected to that type of imbalance in your body. There's another type of headache that is in the back of your head. So like kind of back here at the base of your skull, which that would be connected to your kidneys and bladder. It can also be connected obviously to your neck being out of alignment. So it'd be in the back of your head, and it would be kind of like painful to move your neck or something like that. That kind of headache. Your kidneys rule your low back, your knees, your bones, your overall sense of having energy, big transitions in life, the emotion of fear. I failed to mention the emotion connected to the lungs is connected to grief. And every organ has emotional and spiritual functions in addition to having physical functions that affect that can be connected to why you're having a symptom. So kidney headaches, or the kidney is paired with the urinary bladder, and back here, that's the urinary bladder channel. So that's where if you have that kind of a headache, you would do acupressure on the back of your heel. So it's hard for me to show you my feet. Well, let me see if I can. So imagine, yeah, no, it's hard to do. So the point that you would work on, so imagine that this is your ankle right here. So your ankle bones, and this is the outer part of your ankle. So you would press, so here would be the ankle bone right here. You would press behind the ankle bone right there. And if that made the headache feel better, then it would be connected to your bladder channel or kidney related headache. And so that should help it. Now, the most common headaches and migraines as well, and the kind of headaches that you might have like around your PMS time or around menopausal time or those kinds of headaches are different. And they're probably the most common, but they're the kind of headaches that you would have here on the side of your head. They can be like a band where you'd have this sensation of tightness in your head, or it could be at the top of your head. And all of those are connected to liver and gallbladder imbalance. And those headaches are most common. So, and I'll tell you what the liver and gallbladder do. The liver and gallbladder deal with the smooth flow of energy in your whole body, and they regulate your menstrual cycles. They deal with the emotion of anger. And it's the regulating your menstrual cycles that can often cause like the PMS headaches or the perimenopausal headaches that some women get. Um, it can be connected to dealing with stress. The liver and gallbladder deal with getting things done and dealing with stress. So it's fairly common in our culture where everybody's always really busy to get these kind of headaches that are connected to that. But what I see most commonly is the type of headache that you get when you're having your period. And there are special acupressure points that you can use to treat those kind of headaches. So the kind of headache that you have when you get your period or when you get a migraine, imagine this is my foot again, and this is your pinky toe right here. This pinky finger is your pinky toe, and right at the base of your pinky toe on the side where so I'm going to show you that where the skin kind of is two different colors is right here at the base of your pinky toe. If you press that point and your headache starts to feel better, that is because of a hormonal imbalance. So this is a really good point to press if there's a hormonal related headache. You can also press the side of the nail right here. Again, imagine this is your pinky toe. So you press right here at the side of the nail and right here at the base of your pinky toe. And that should help relieve that kind of headache, the kind of headache that you get when you're having your period and you're out of balance. Now, there are other types of headaches that are this kind of pain where you have a band around your head or feeling it at the top of your head. So again, imagine this is your foot now, and this is your big toe, and this is your second toe. So for me, this is a longer toe, but right between, so kind of similar to the one for sinus headaches, there's a point between the two, the big toe and the second toe right here. That's a liver point. And if that relieves this kind of headache, then that's connected to stress. Or again, it could also be a menstrual type headache. So it could be a menstrual type headache that is connected to your liver being out of balance. But if this point on your foot releases the pain, then that's not a hormonal headache. That's more of a liver imbalance kind of headache. So you might have that headache, let's say if you ate the wrong kind of foods, or if you got a caffeine imbalance or something like that, this point would be really good. Now there's another point, and then imagine this is the outer ankle bone right here. So what we call the lateral malleolus. So your ankle has two sets of ankle joint, right? On the right side, on the inner side and on the outer side. And on the outer side, there's like if you slid around the bone toward kind of not on the back side, like for the back headache, but right kind of towards the front, like right there. That is also really good for these kind of headaches. So it's on the side here of the ankle bone, and you press right in here. And if you press this point and this point on your foot, then and that relieves your headache, then you know it's that kind of a headache that you're having, a liver-based or gallbladder-based headache. So I've given you sort of four different tools that will help you with different kinds of headaches that you might have. And you could try, like if you have a headache and you're not exactly sure what kind of headache you have, this is your first bet, like you're safe. Like a lot of people get relief just from pressing right here, simply because this point also drains the head. And so we're talking about your hand now, not your foot. So if you have any kind of headache and you're not sure which one it is, try this point first. If you know you're getting your headaches around your period, then do that pinky point, pinky toe, like your pinky side of your nail, or your pinky, like right here at the base of the pinky toe. A hormonal headache will get better with these kind of with these 2 points. So you press on these points, and if that relieves it, then you know it's a hormonal headache. Some people, even when they're not having periods, will get a hormonal headache because there are still hormones cycling in the background, even if you don't have periods. So you could try these points and they may relieve it. I helped a friend of mine the other day, and she wasn't having her period, but when she had a terrible migraine, and I pressed these points and it got better. And because she suffers from estrogen dominance. And so if you have estrogen dominance, or or your hormone levels kind of fluctuate a lot, that's a great point to test to see if that will relieve that kind of headache. And then I was talking about the one at the back of your head. So I'm just reviewing here. So the one at the back of your head, like here at the base of your skull, that would be behind the ankle, the outer ankle bone, kind of sliding behind the bone, straight behind it, and kind of going right there in your heel. So kind of it'd be between your Achilles tendon and the outer ankle bone. You slide there and press there, and that will possibly help your headache. You can even kind of go around your Achilles tendon and kind of do this thing where you press both inner and outer parts of the ankle right there. And then the last one is the liver kind of headache, where you press in your toes or your feet between your big toe and your second toe, right there, similar to the one that's for your sinuses. Okay, so I hope you found that helpful for dealing with headaches. And here's a couple of other tips that might help you if you have continuous headaches or regular stress kind of related headaches. So if you feel like headaches are related to tension or stress in your body, then one thing to do is to be very consistent with your caffeine intake. So if you take, let's say, coffee, and you drink a cup of coffee every day, but you take different amounts of caffeine when you do that, or you're not consistent with the exact amount of caffeine that you have. If you are a person who is sensitive to caffeine and consistently has headaches, you should make certain that you're taking the right amount of caffeine at the same time every single day. Caffeine has an effect on the blood vessels in your brain and can cause them either to contract or shrink. And if you miss a dose, or if you get the wrong dose, you could be that sensitive where you could get a headache because you're not consistent with your caffeine dosing. Another cause of chronic headaches that people have for a long time or every day or all the time is a possible sensitivity to gluten or dairy. I've had lots and lots of patients over the years who struggle with everyday headaches, and some of them are teenagers who had headaches for years and years and never had any gut issues but had headaches. And especially this one, that 17-year-old who was having headaches all the time. She cut out dairy. She stopped having headaches. Same with some people who get migraines. Some people get migraines because they're allergic to gluten. And again, you may not know that until you've tried cutting it out altogether. So if you have a story of really chronic, consistent headaches, I would suggest that you cut out gluten and dairy for a few weeks and then see if that helps get rid of the headaches. Okay, I hope that was helpful to you, and I hope you have a wonderful, wonderful day, and I'll look forward to seeing you again next time. Have a great day. Bye-bye.